Welcome everybody to our important dialogue today at this very important and critical moment in the history of the pandemic in New York. We intend to share with our audience information that we have gathered through primary polling of New York City and residents of Harlem. As you can see, today we have with us one of our main experts in City University of New York, Dr. Scott Ratzan, who is our faculty and expert on vaccine hesitancy, both in New York City, nationally and globally, and myself, Ayman El-Mohandes, the Dean of the CUNY Graduate School of Public Health and Health Policy. Now we move on to our presentation, and as you can see from our first slide, that we are going to be sharing with you findings from two citywide and Harlem surveys conducted in January 2022 in a series of approximately 20 polls that we conducted since March of 2020, when the pandemic declared itself in New York City and the United States in a very aggressive way. Our interest over time has been to look at the economic outlook and financial hardships that were incurred by the citizens of New York, and especially our neighborhood here in Harlem, looking very specifically at food insecurity as a manifestation of economic instability. We will also be discussing the rates of COVID vaccination and boosters in New York City, and as well as the information we gathered from respondents to our poll regarding their utilization of home testing and their adherence to masking during this phase of the pandemic. The next slide, as you see, is an important one, since it shows us what the public predicts regarding the economic recovery of New York City. And we compare the respondents from New York City in general to respondents in Harlem. And it is obvious that the vast majority of our respondents agree that full economic recovery in New York cannot be attained until more people are vaccinated. 37% of respondents in New York and 34 respondents in Harlem believe that to be true. The second most frequent response was that we will probably not get to full recovery before March of 2023, in approximately a year from now. But there is a sizable number of respondents, almost 1 in 5 of Harlemites, who believe that we will never be able to return to where we were before the pandemic. If you look at New Yorkers in general, 1 in 6 believe that to be true. Next slide, please. When we look at the expression of financial hardship, the citywide respondents assessing their current financial situation compared to how it was when the pandemic started in March 2020, you will see that 34% of the respondents believe that they are worse off today than they were about 2 years ago. But 22% report being better off now than they were. Those that look at a year ahead from now, how things will be for them, citywide, 38% of respondents believe that their economic situation will improve within 1 year, while people in Harlem seem to be more positive, more optimistic in their outlook, believing that they will be better off in the year ahead than they are today. The next slide begins to show us a very grim picture of food insecurity in the here and now. It is hard to imagine that citywide in New York City, 34% of our respondents believe that they have serious concerns regarding food security in their household. And 49% of Harlemites reported this concern back in June of 2020. Today, still in Harlem, more than a year and a half later, 41% of our respondents in Harlem continue to have serious concerns about food security in their household. Comparing those that are most likely to experience food insecurity in Harlem, we see a very clear differences across racial and ethnic groups, where 55% of the Black residents in Harlem are those that have expressed food insecurity, comparing to 21% of Latino residents, 12% among whites, and 3% amongst Asian residents. When we looked at other criteria, we found that having a high school degree or less compared to some college or graduating from college, 54% expressed some degree of worry about food security. Those of the younger age group between 18 and 29, 55% expressed concerns about food insecurity. And obviously, the association between income and food insecurity, we see that those that earn less than $25,000 a year are, in 53% of the cases, worried whether they will have enough food on the table by the end of this month. Next, please. Then we start to look at vaccination rates citywide, in Manhattan, and in Harlem. And that's a fairly important slide to look at because we keep hearing a lot of opinions about whether people in Harlem are getting the vaccine. And as you see, 43% of Harlemites have received the booster, compared to 46% in Manhattan and 36% citywide. So people in Harlem have not received the booster in lesser percentages than people in Manhattan, except by a very small percentage. Nonetheless, we are hoping that a higher percentage will have received the booster. When you look at the unvaccinated, that's where you see a difference that's concerning, where in Harlem, 10% are unvaccinated compared to 5% in the rest of Manhattan. But nonetheless, the percent of unvaccinated is still lower in Harlem than it is citywide, where citywide 14% are unvaccinated compared to 10% in Harlem. Next slide. My final comment here before my colleague, Professor Scott Ratzan, takes over is a comment on booster rates across the various boroughs of New York. And as you see, the lowest rate of booster is in the Bronx, which is very concerning since the Bronx bore a heavy burden of this pandemic with a very large number of people dying and a very large number of people getting sick. In Queens, 40% have received the booster. In Brooklyn, 32%, equal to the number in Staten Island. Obviously, when you look at this picture in general, you are concerned because we do expect a higher percentage of our population to have received the booster, especially that from our most recent experience with Omicron, less people got very sick and less people were hospitalized if they had received the booster dose. At this point, I would like to hand over the presentation to Professor Ratzan, and he will discuss the findings on the next slide. Professor Ratzan, please.
Great. Thank you. And really, let me thank the Dean for a great presentation and the opportunity to bring data together like this. This is the first time when we've been able to put together both superimposed data on vaccination rates that was provided by the Department of Health and Mental Hygiene in New York City with our data on Harlem, as well as you saw some of the other slides comparing where Harlem was and the city 2 years ago. In March 2020, right when the pandemic began, we began doing these surveys 2 days after the WHO declared it a pandemic. So we have a lot of data both on the trends as well on attitudes and beliefs, and superimposing this amongst all the areas that are important to New Yorkers, notwithstanding the food security issues, the economic recovery issues, and so forth. But I'll focus on the next slides on where we are with the vaccination rates. And for better or worse, you saw the slides before that New York is at 14% of unvaccinated. But as we looked at the potential for boosting, while it was different in different regions, different boroughs as well, we have seen here that the Omicron variant, and before it was even called BA2, I was hesitating because now this is in January, did encourage boosting. And citywide, because of the Omicron spreading, you could see 57% reported yes on our survey, and a very high amount as well, very close in Harlem as well. If we go to the next slide, we also think probably the more important area to think about now is as the vaccine has been approved for children. And we've asked people both willingness to get the vaccine as well as then their actual, did they get vaccination for their kids? And, as you can see here, intention always is higher, but then it's sometimes an access issue. Can they take a day off of work? Is the vaccine available at the school, the physician's office, the neighborhood community health center? But we are actually pretty positive that in January, the numbers are pretty high. And as you can see, Harlem is higher in both the willingness and the actual vaccination rate. And frankly, this is not continuing in the same trend since January, that the vaccination rate amongst children has slowed if you look at the Department of Health data. But nonetheless, people do have the high intention to vaccinate, and we have to help figure out how to activate them, if I can say that. And really want to thank all of you for the work you do, not only your elected roles, but community organizations, family members, parents, and so forth. The next slide, please. We show something that we thought was very important to measure. How angry are people with those who are unvaccinated? Are the unvaccinated people hindering us from getting out of this pandemic? Are the unvaccinated people making it more difficult for us to go back to work or to school? And we asked this, how angry you were. And surprisingly, almost two out of three people in Manhattan are angry with the unvaccinated adults. Now, we're very interested, of course, in equity and social justice. So we're very careful not to shame those who are unvaccinated, but yet in the reality is people are angry, and you can see both citywide and in Harlem, it's a significant number. So we have to look at these sentiments and also think about how we deal with the mandate issue and requirement issue. The next slide, we also have continually asked how people feel about the serious nature of getting COVID. And the higher the risk of getting COVID or people's perception of it, the more likely they were to get a vaccine. So here you can see citywide, it's about 28%. This is in January, still are worried about serious illness, and 24% in Harlem. So still, it's very close of Harlem, tracking a good part of where the city is. The next slide on the importance of getting free COVID tests. Of course, these were announced by the federal government. And it may have taken some of us longer to get them if we registered online. Just our anecdotes of our team. Some of us got them much quicker. So it didn't necessarily matter which borough. It might have been from another decision or a reality. But we did find that more than half of New Yorkers had ordered a test by the end of January, and very, very close in Harlem as well. But amongst all respondents, the reasons people wanted a home test is one, they wanted to have a home test available if they had symptoms. One, in case they needed it, even without symptoms. Three, to take a test before getting together with friends or family. And then some of them wanted to have a test at home because they thought they might need it for work, or to have a test if they needed to travel, and so forth. But still, about 1 in 6 people citywide think they didn't need a test at all. And perhaps, although we didn't look directly, these are some of the unvaccinated or people who didn't feel they were at risk. And then finally, people like the home testing, and why, it's good that the federal government's also increased the ability for people to reorder them. 38% of the people like it for the convenience, 29% because of the long lines that they've had in the city. And the long lines actually were the biggest concern in Staten Island than all the other boroughs. So there is some difference across the city, but nonetheless, people are applying for the free COVID tests. The next slide just shows the use of the free at-home testings by borough. I mentioned some of these, but it seems like people in Manhattan were more apt to use the tests. And of course, the vaccine booster also, as you may recall, was highest also in Manhattan as opposed to some of the others. The next slide shows who tested positive for COVID-19 during the Omicron outbreak. And the Omicron outbreak, spread very quickly and was much more virulent than any of the other, even more than Delta. Fortunately, it was not as deadly, but it also tended to travel through the younger population perhaps being more mobile, perhaps also not engaged in all of the other preventive behaviors. But I think what's most important is that 27% of people tested positive here, and still a significant amount tested positive in the other groups as well. The next slide shows, again, who is testing positive and where the people lived. And in the center, the mean would be citywide, 21% of people tested positive during this Omicron outbreak, at least in January. And as you can see amongst the boroughs, Manhattan, again, the highest, and Harlem directly the same as Manhattan in the testing in this outbreak. So 1 in 5 people had tested positive, and the virus was clearly spreading amongst both the unvaccinated and, unfortunately, if I can say, even amongst some of the vaccinated or non-boosted or vaccinated but not fully vaccinated yet. And this is part of the challenges that we had of the communication of what was up to date, what was fully vaccinated, and when one might want to have a booster or be eligible to have a booster. So there are a lot of challenges here, but this is a very high positivity rate during this whole pandemic. And then, my final slide here is showing that only 6 weeks ago, a majority of New Yorkers always wore a mask in public, and it was even higher in Harlem than it was citywide. We have not rerun the survey this month, but there have been people that are starting to say that the masking, just like many of the other issues, as the policies change in terms of vaccination status, as a requirement for entry to certain events, is changing. Also, people's protective behavior is changing, and masking is going down. So I think this is just a reality where we were with the guidance. That's very, very positive, frankly, that people were always wearing a mask in public at this high level. I think we need to assess, how important masking is, both for schools, for public, for events in the future. So with that, there's quite a bit of other data that's behind this. We've been fortunate to be engaged with the New York Vaccine Literacy Campaign and the Harlem Health Initiative. These are our activities at CUNY School of Public Health, linked with our community organizations, Deborah Levine with the Harlem Health Initiative, and a whole group of us that have been engaged with the vaccine literacy activities. But with that, hopefully this was a good overview to help us think about our policymaking, about how we hope to protect from the next, and I say the next, whether it's an Omicron surge, BA2 surge, or a next variant or next pandemic. And we're doing a lot of other work in that regard at the school. So with that, I'll turn it back over to the Dean for concluding remarks, and appreciate the opportunity to be engaged in a meaningful way with all of you.
Thank you very much, Professor Ratzan. And we are open to your questions. We can receive the questions post hoc, and we promise to respond to them as quickly as we can. As you know, this is still a dynamic phase of the pandemic. We cannot presume that the pandemic is over. Briefly, Professor Ratzan talked about the BA2 variant, which is the next variant that is increasing in frequency here in New York City. The international and other studies have shown that this variant is 1.5 times more infectious than Omicron. There is no guarantee what the next variants after that will look like, and so we cannot put our guards down. The fact that the mandate for a mask is no more does not mean that we do not practice personal responsibility and make good choices. We have been now with the pandemic for 2 years. We have learned a great deal about it. Even the layperson knows a lot more about safe behaviors and how to protect ourselves, especially the vulnerable amongst us and our families. With that, I thank you for your participation and hope that any questions you may have, we will receive and respond as soon as we can. Thank you very much, and enjoy the rest of your day.
I commend the CUNY Graduate School of Public Health and Health Policy for undertaking this survey that covers a broad range of issues that impact the lives of Harlem residents. We know that COVID-19 has ravaged our communities in every imaginable way. And this survey provides a wealth of information regarding Harlem residents' feelings about their health, their livelihoods, and steps that they are taking to keep themselves safe. And while more Harlem residents responded as feeling optimistic about the city's recovery from the COVID pandemic than the rest of the city, yet over 1 in 3 survey participants reported that they were still worse off than before the pandemic began 2 years later. This informs us that we must do more in the recovery to address basic and fundamental human needs, including food insecurity and access to quality and affordable mental health care. We must continue to create innovative, effective, and community-centered approaches to promote continued increases in vaccination rates among all ages. The National Black Leadership Commission on Health, known as Black Health, working throughout the Harlem community. We are very pleased to join CUNY Graduate School of Public Health and Health Policy in this critically important endeavor.